So now you're watching Midday Live on TV3. Thanks so much for joining us. Our pages, News on TV3, at News on TV3 is very active. Our website, tv3network.com. Go there and read more on the stories trending. Now, to another one that's emerging, really, it's the Ghana Medical Association says its members working in public health facilities across the country have resolved to resign unless government backs a request for the establishment of a collective bargaining agreement by the end of June. The association first issued the ultimatum in November 2014 when they set a June 30 ultimatum to the government to put together conditions of service for its members. Now, Joy News reports that the doctors met with Employment and Labour Relations Minister Haruna Ejusu April 7, 2014, to reiterate their point. Deputy General Secretary of GMA, Dr. Justice Youngson, says the absence of a collective bargaining agreement for the group was a violation of the labour law. And he says that if the government delays beyond the June 30 deadline, they would not have any option than to leave the consulting rooms of public health institutions. He said, as a group, doctors as a group, professionals in the country cannot continue to work under the current conditions if government as an employer refuses to provide appropriate conditions of service. And the president of the Ghana Medical Association, the Deputy General Secretary of the Ghana Medical Association, Dr. Justice Youngson, joins us on the phone line. Good afternoon to you, and thank you very much for joining us.
Afternoon.
All right. Have you had any response from government?
We've had some contact with the Ministry of Employment, we sent to the Finance Ministry as well. We have some discussions yesterday.
Dr. Youngson?
Yes.
Yes, we can barely hear you, so if you could just position yourself well for us.
Is that a bit better?
Yes, thank you. Yes, go ahead.
Yes. We've had some initial discussions with the Minister of Employment, the Deputy Minister of Health, and some officials from Finance, Services, and the Employment Ministry as well. So for now, we have basically decided that we want to continue with the negotiations as we started as of today, or as of yesterday. Continue to cooperate, but we are still reminding government and employers, yes, our concerns are still genuine, and we want resolution by the 30th, as we did in our earlier release. So that's it.
Well, what's the posture of the minister to begin with? Because he described it as it will be illegal, really.
So, illegal to do what?
I'm saying, what's the posture of the minister?
No, of employment. The what are illegal.
Yes, Joy News reported that he said it will be illegal for you to strike.
By a strike, we are saying that we will resign and block and give back their jobs to them. How tell a man to work for you? So what is illegal about this? Who doesn't really care about the conditions under which the employee works?
Hello?
Yes.
All right, the line. We'll try and get Dr. Youngson back on the line. I can barely hear him, but we'll speak to the PR for the Ministry of Health, Tony Goodman, as well. Good afternoon, Tony, and thank you for joining us.
Good afternoon.
I'm sure you've heard the threats and the like. What's the ministry doing currently about it to avert any further strikes?
Thank you very much, my sister. What we are doing, we have already started working on this particular document. At the last meeting, GMA was there. As I speak to you, the president of GMA is chairing that particular committee to finalize the document. So it is not as if we are not doing anything or we are not involving stakeholders involved in this particular issue. They are part of the negotiation. We are putting together this document for it to be finalized so that at least we all have a document to work with. But there is one thing that is clear. We want a condition of service for the health sector. But that doesn't mean that as a country we don't have condition of service for public workers and civil servants. We have. But this is for health workers, condition of service means that a document that spells out what you are going to be doing from day one to your exit, which is retirement of your service. So there is a document. Various hospitals have various documents. So there is something. That is what we are developing to have a holistic policy in the sector. So as I speak to you, the chairman of GMA is the chair, and they are working at completing this document for it to be operationalized.
All right. One of the things they also mentioned was the issue of newly graduated doctors who haven't been employed, even though the country needs more doctors. Where are we with that?
Yes, what we are doing is to make sure that these doctors are posted. That is done by the registrar of the Medical and Dental Council in collaboration with the Ministry of Health. Places are identified and then those doctors are posted. So that is in the process, and very soon those who have not received their postings will be posted to their various hospitals.
But what causes the delay?
There are a lot of factors, but it's internal. We are working on those particular issues, and I think very soon all those issues will be addressed.
All right. Tony Goodman is a PRO for the Ministry of Health.